If you're a parent sorting through ADHD medications or an adult finally exploring treatment, Adzenys extended release might come up in your search, and I hope it does. It's a dissolvable extended release amphetamine or stimulant that promotes smoother days and fewer struggles for most of my patients with ADHD. I'm Dr. David Danish, a double board certified psychiatrist specializing in child, adolescent, and adult psychiatry and ADHD across the lifespan. In this video, we'll cover what Adzenys is supposed to do, what side effects to watch out for, and my honest take from years of working with patients of all ages and backgrounds who struggle with ADHD. Adzenys is one of the many stimulants out there that treat ADHD. Stimulants like Adzenys boost dopamine and norepinephrine, two brain chemicals tied to focus, motivation, impulsivity, and emotional control. Adzenys, unlike many other stimulant options, is built with a dual release technology. Some particles kick in right away, others activate later, carrying you through the day. It's extended release. It's a once-a-day medication. That helps smooth out the spike and crash you might feel with other stimulant preparations such as Adderall extended release or Adderall immediate release. Adzenys is FDA approved for treating ADHD in kids as young as 6 and older. I use it off-label in adults who want a steadier, more predictable experience with their stimulant. Let's talk about what to expect. The top 3 common side effects that I see on a regular basis are fairly minor, but do occur fairly frequently. The number 1 is a decrease in appetite, especially at lunchtime. It shows up in nearly half of my patients. The other one, if it's taken too late or if it's too strong or you break it down slowly, is insomnia. This is true with any extended release preparation. Now, the good news here is that Adzenys tends to be less likely to cause that compared to, let's say, Vyvanse or Mydayis. But if it's causing insomnia, even at lower doses, it might be a sign that you either have to take it sooner in the day or that your body's just breaking it down too slowly and you have to try something else. Another consideration that occurs in less than 1 out of 10 people I see on it is irritability. Usually when the dose wears off, or if the dose is just too strong, or if stimulants are simply not the right fit. If irritability is occurring during the day when Adzenys is on board, that's a sign Adzenys, at least, and maybe all amphetamines, it's hard to say, trials have to be done, may not be the right fit. But that's less common than I do sometimes see Adzenys causing irritability when it wears off, let's say at 3 or 4 or 5 o'clock in the afternoon. Now, fortunately, Adzenys tends to do that a lot less than Adderall extended release, which is one of the pros, one of the reasons I choose Adzenys for so many of my patients. But if it does occur, there are strategies you can use. You might switch to Vyvanse, which has a longer mechanism of action, so it lasts longer and comes off even slower than Adzenys. You might do a short-acting Adderall at 3 o'clock to get ahead of that wear-off anxiety or irritability. Other common side effects are mild stomach upset. This tends to fade with time. Some complain of blurry vision or eye strain, not super common, but I have sometimes seen it. Others may see exacerbation of Raynaud's phenomenon or numbness in fingers. That's something that you should definitely talk to your provider about. Some will have an increase in heart rate on blood pressure with stimulants, and that's something that needs to be monitored. Now, in rare situations, if someone is on the bipolar spectrum and maybe is not yet diagnosed, we need to watch to make sure any stimulant medication does not flip them into a manic episode or a psychotic type symptoms. Again, exceptionally rare, but it can happen if they're potentially on the bipolar side of the spectrum. Also, something I cover with all of my patients and their families is, like with any stimulant, there is a risk of misuse, especially if there's a history of substance use. Now, I want to be very clear about this. All of the data shows that if we properly treat ADHD with stimulant medications, the risk for substance abuse drops tremendously. So I want to convey that if someone has ADHD and you're worried about starting them on a stimulant because it may lead to substance abuse, the research shows the exact opposite, as does my clinical experience. You need to make sure someone is not at risk for diverting it, selling it to friends, or using it recreationally. Here's how I talk about Adzenys in the office. If Adderall extended release is a pickup truck, strong but bumpy, Adzenys is the luxury sedan. Same power, but a smoother ride. In my clinic, about 8 out of 10 patients who've tried both Adderall and Adzenys prefer Adzenys over Adderall. It's smoother, less choppy, less intense, but still helpful. It's my go-to when kids or teens cannot swallow whole pills or they need a stronger option compared to the methylphenidate brands such as Concerta or Focalin. Or it's my go-to when an adult has not yet tried a stimulant for their ADHD, and usually in adults I prefer starting amphetamines because they are more effective with equal side effect potential as the methylphenidate side of things, which is not so true in kids where methylphenidate should be started first in most cases. If you or a loved one is considering starting Adzenys for ADHD, you're looking at a well-designed, clinically strong opinion. But here's the truth. Medications are just the start. It's how you use them and how you support them that really makes all the difference and changes lives. I've built out the full support system for you at drdaviddanish.com, including executive function support, which is as or more important than medications in treating ADHD. Also, in my Mind Vault, you'll find my full breakdown of side effects on all mental health medications, and ideally how to handle them or when the side effects are so intense you need to consider a change. Plus, I've created a full list of on and off-label treatments for ADHD, all medications that have some benefit, including their pros and cons, and I'll put a link to that in the description. If this helped at all, please like it, please subscribe, please share it with others so we can get the word out there.